Sir, I have make you the co-host, sir. You can share the screen and start the class, sir.
Shall I start now?
Yes, sir.
Okay, thank you so much. So, hello everyone and welcome. Okay, so hello everyone and welcome to this another important session on our topic of genetics. So, we had two sessions on genetics and this is the second one. In this session, we'll be dealing with some of the genetic disorders and other clinical genetics. We'll just go through it. So welcome again, guys, to this second session on genetics. I hope you enjoyed the first session. And yeah, remember that there was some technical glitch in the first session. So some MCQs we weren't able to see, but the good point was that I was able to read out the entire question and the options. So that will obviously help you because you know the question and the answers by now. So go to our first session also of genetics and have a review of it. And then this is obviously going to help you it. So this best benefited for university exams as well as your other MCQ exams. Uh, yeah, I'm Dr. Ankit, your faculty of anatomy, and you can use the code over here for discounts on subscriptions. Again, a screenshot of this particular slide I always advise so that you have a good idea of what are the types of questions that can be asked from this particular topic of genetics. Why to choose Auricle? Again, these are all the points of it. We'll just go through it. Just let me show you the subscription part so you have a good idea of what it is offering. And in that part also, all these things are written. So yeah, this is the these are the four types of subscriptions you can see over here. And obviously, you can use the code Dr.Ankit 20 DRANKIT 20. So yeah, we have a foundation plan, we have advanced learning, complete learning, and ultimate MBBS plan. You can see what is been given to you. Basically, it's a difference of the time period from 3 months, 6 months, 12 months, and around 4 years. And more and apart from the time period, it's also these last 2 points. Like in the last two subscriptions, you will also get, along with all the recorded live classes and the Q bank, you also will get the hard copy notes as well as the doubt clearing session. The rest, all these things are also very important: recorded classes, live classes, exam module, Q bank practical sessions. And in this last two, you have other two things. Okay, so let's jump to a topic of genetics now. And let me take you straight away to the topic of genetics over here. So mode of inheritance and gene disorders is one important thing of what we are going to discuss in today's discussion. Let me go through it. So inheritance follow the following patterns. We have a monogenic inheritance and we have a polygenic inheritance. If you remember the previous session, we discussed an MCQ also on polygenic inheritance. So monogenic is obviously single gene, and it is, we all know from school time, the Mendelian inheritance. The Mendel's laws over here are applied over here. The polygenic inheritance are for have a multifactorial inheritance. Obviously, the name goes with polygenic. How to show in the pedigree of it? So normal male and female is shown by the male is shown by the square and female by a circle. If any of the male or female is affected by any disease, then obviously they are shown in the bold colors. I mean bold. I mean the circle and the square are filled up. Consanguinity means a marriage between the close relatives. That is a consanguineous marriage. And if you remember that I discussed a small part in the last session also about consanguineous marriages. They are not good for the genetic disorders, and it is being taken into governments also of various countries where few most many of the people, they go for consanguineous marriages. They have the different reasons why they go into it, so that's a different point. But yeah, this consanguineous marriages leads to various genetic disorders, and that puts a great burden on the government and the society as a whole, because the more genetic disorders, the more treatment is needed, the more hours of work is affected, and obviously it ultimately boils down to the poor performance of the economy. So if you try to understand it in a holistic way, a small thing as consanguineous marriages for a country and can lead to a greater impact for the long term things like that. So just giving you other perspective. So we have the death and the propositors and parents and children are shown in this way. Okay, let me move ahead and just to revise you some points over here, what we already used to discuss earlier on. So what is pleiotropy? What is variable expressivity of gene, reduce or incomplete inheritance, and sex limited trait? These are important points, and just go through it one by one. You will try to understand pleiotropy, a very important point of pleiotropy. Single gene disorder produces multiple phenotypic defects. So there's a single gene disorder. Single gene disorder. Phenotypic means what is shown to the body. So like single gene disorder, and there's problem in the heart, there's problem in the liver, there's problem in the gut system, there's problem in the immune system through a single gene disorder. So that is known as pleiotropy of the gene. I hope you got the point. So remember this. This is very important. Then here variable expressivity of gene. Expression of the gene may be mild, moderate, or severe form. Same sort of genetic disorder in two individuals might not be the same. Some might be mildly affected, some might be moderately affected. So that is also pointed out as a variable expressivity of a gene. Try to understand. Then we have reduced or incomplete penetrance. Person dominant for a heterozygous character fails to manifest disorder clinically. So not homozygous. Homozygous, I hope you all must be knowing homozygous and heterozygous. Homozygous has two same alleles and heterozygous are different. One is normal, one is affected one, that is heterozygous. So person dominant for a heterozygous character, suppose that has A and A is A1 affected over here, fails to manifest the disorder clinically. So even that heterozygous had a reduced or had an incomplete penetrance into the entire functioning or entire biochemistry of the cell and the tissue as a whole. Can understand it. So that is incomplete penetrance. And sex limited trait, expression of a trait is limited to one sex. There will be few disorders, particularly as you will see the X-linked and the Y-linked diseases. They are limited to a one particular sex. Supposedly there's a Y-linked disorder. Y-linked. Now Y chromosome is only seen in males. So obviously it will be only manifested in males. Okay, you'll see it later on. Then the other things over here which you need to understand, what are their sex influence trait, a trait which is expressed differently in males and females. There are some traits may be differently expressed in males, some may be differently expressed in females. So that is sex influence trait. Understand this. Codominance, both traits are expressed fully. Codominance. Intermediate inheritance. A recessive trait in heterozygous condition shows an intermediate expression between a normal and an abnormal. So somewhere in between, you have a heterozygous condition with the recessive trait in between. That is intermediate inheritance. Okay, so these two slides over here, the important points you should know that these form the basis of the understanding of the genetic disorders. Okay, now monogenic or Mendelian inheritance has to begin with. We are over here. Follows Mendelian laws, can be autosomal inheritance or sex-linked inheritance. So we all know that 44XX or 44XY. Okay, so we have 22 pair of this and one pair of XX chromosomes, 22 pair of autosomes and one pair of X chromosomes, right? So it can be either autosomally inherited or could be a sex chromosome inherited. I guess we all have learned about it, so we'll just go through it in a bit that we have good revision. Autosomal inheritance due to gene present on autosomes could be dominant recessive. Sex-linked inheritance by gene present on the sex chromosomes can be dominant or recessive. Fair enough. Okay, let us see a bit of it. The autosomal dominant. Now, gene expresses clinically even in single dose heterozygous state. So, understand. Suppose there is that is normal A and A. Now, this is affected in capital A and single A. Even if this is present in any individual, that will be expressed clinically because this is autosomal dominant. The capital A, even it is only single dose, even then it is clinically okay. To express clinically. So that is autosomal dominant. I hope revision done. Autosomal recessive is trait is manifested only when gene is in double dose. So in autosomal recessive disorder, A.R disorder, this won't manifest. It will be acting like a carrier. And autosomal recessive disorder will only be expressed clinically in a homozygous state like A and A, right? Only then it will be clinically manifested. That is autosomal recessive. And autosomal dominant will be affected in this way also, in this way also, because it is autosomal dominant. I hope had a brief good idea of it. Some of the common diseases, names you should know at least in first year. You should be well versed with at least the names over here, right? So let us see some of the names of autosomal dominant inheritance. Common baldness. Okay, genital ptosis. So you might see common traits disorders in that might run in families. Brachydactyly. Okay, less number of fingers. Genital cataract, achondroplasia. Then we have Huntington's disease. Now, don't worry if, as you are in first year, by the name of the diseases, for example, say Huntington disease. Now, you might be worried of what is this disease, because you hear these sort of terms very rarely in your immediate society. Very rarely you will hear about like having Huntington's disease or having achondroplasia. But don't worry, as a doctor, as a medical, we should know because they come to us in hospitals, and details of the diseases obviously you will encounter as you go forward. So all my point over here is don't get intimidated or mesmerized by so big terms. They're nothing. They're simple diseases. Time will come and you will get to know them in detail. For the first year, just at least know their name so that by second or third year, as you learn them in detail, you have some idea. Okay, this word I have heard somewhere. Yeah, I used to hear it when sir used to teach about the autosomal dominant diseases, something like that. That is enough. So at least you know that okay, this disease is autosomal dominant. I don't know what happens in this disease, but this is autosomal dominant. Even that information for the beginners is good. I hope you're getting the point. Now, this is what you need to understand. What are the characteristics of autosomal dominant inheritance? I hope you understood autosomal dominant will be manifested in this way also, and obviously both in heterozygous and homozygous state. Males and females are equally affected. Point number one, obviously, because it is not sex linked, it is autosomal. Transmission between all the sexes. But it is not sex linked, male to male. Male can be transmitted to male, female to female, male to female, female. That is common sense. Then trait seen in every generation without skipping. So it can't be skipped. Some trait of it will be seen in every generation. Like, getting a point. So every time, even if a heterozygous marries a normal female, then the children over here will have some traits. So trait will be passed on to the generations. Yeah, in every without skipping. Some traits will be there in every generation. Number of normal and affected children generation is in equal proportion. For example, let us point out over here. So you have over here this, and you have double A. So number of affected and non-affected. Okay, you're getting the point. A to A, then okay. So it is 50-50. So number of normal. So this double A is normal. Let me point it out in a separate way over here. So this and this. Okay. Let me make it this way. Pen doesn't work sometimes efficiently, but I hope you're getting the point. Okay, it is double small a. This again is small a. So these two are normal. These two are affected. So number of normal and affected children in a generation is in equal proportion. That was the last point. Okay. Affect other points of autosomal dominant inheritance. Affected person always has an affected parent. There will be an affected parent, only then there is an affected person. If there's another statement, if the parent is not affected and the trait has appeared first time, okay, there is achondroplasic child, both the parents are normal, then it means that new autosomal dominant mutation has occurred. Understand this. It's the beginning of a new disorder. Now, he will be the first case of that particular disorder in his entire generation if it progresses forward. New mutation occurs at the time of gametogenesis. Gametogenesis, all this meiosis, mixing of cells, new mutation will occur at that time. Normal offsprings do not transmit the disorder to the next generation. So, it's previous slide we have seen that these are normal offsprings, the small a's, they won't transmit it to the forthcoming generation. That is good news. Okay, understand this. This is an autosomal dominant. You can see male, female, they're passing on to different. So this is an example of a normal autosomal dominant pedigree chart. Okay, now just a second. Let me show you what. Let me just do some MCQs over here also meanwhile, so that we have a touch of that too. Let us start with this MCQ over here. So we'll do two MCQs. Okay, each break we will take two MCQs. Which of the following is an essential part of genetic counseling is the question over here. Which of the following is an essential part of genetic counseling? Is it genetic testing, radiation therapy, antibiotic treatment, or chemotherapy? I urge you guys to in the comment box you can write ABCD if you are listening over here live. If not, even then later on also you can write it down. Let me also check it in the meanwhile. Take 30 seconds at least. 30 seconds is enough, I guess, for this particular. Okay. In the comment box you can answer. Okay, A, B, C, D. So which part is essential part of which of the following is an essential part of genetic counseling? A is genetic testing, radiation therapy, antibiotic treatment, or chemotherapy. Think. Answer over here will be, I guess the time is over. Answer over here will be option number A, genetic testing. Genetic testing is an essential part of genetic counseling. It's an essential part of genetic counseling. Understand this, right? Obviously, these won't be sort of common sense question. Let us do one more. One more. Genetic recombination occurs primarily during which phase of meiosis? Genetic recombination will occur primarily during which phase of meiosis? Yeah, prophase, metaphase, anaphase, telophase. So there are all these four options. What would be the answer? If you have gone through the, again in the school time, 11th and 12th biology, we used to learn in detail mitosis and meiosis. Genetic recombination used to come as an MCQ also in NEET UG exam. Normally occurred in prophase 1. Mostly occurs in prophase 1 is the time when the genetic recombination will occur. Because these two questions here, prophase 1, and here we have genetic testing. Okay. So 2 questions done. And as promised, we'll move back to our discussion and then we'll come back after some time with another couple of questions and the couple of questions, right? Okay, so let's move forward over here. Okay, so see some detail of and the disease Huntington's chorea, which sort of inheritance it is. It is our autosomal dominant. So it occurs 1 in 15,000 people. Starts around 40 years. Involuntary movements like facial grimacing, twitching of face or limb muscles. Now see guys, as you will progress more in first year, see medicine is such a beautiful line now. As you will progress more in the first year, and you will enter the neuroanatomy and neurophysiology in both anatomy and physiology classes. You will enter into neuro part, brain part. There you will understand of us in our brain there are various areas, and here we have an area known as the basal ganglia or basal nuclei. Basal ganglia, basal nuclei. Then you will understand about their diseases. Then again this term will again come because it has involuntary movement, so it is linked to the neural problems. Okay, like facial grimacing and twitching of face and limb muscles. Progressive cell death in CNS, as I told, as you reach the neuro part in your both N and physio. And gene located where? So it is genetic disorder on chromosome number 4, short arm of chromosome number 4, 4p. 4p. So it can be another MCQ 4p, 4q, 5p, 5q, something like that. Remember, it is of 4p. Okay, Huntington's chorea. What is achondroplasia? 1 in 10,000 person is dwarf, so person is dwarf. Less height over here. Normal intelligence reproduces normally. So elsewise the person is normal. There's normal intelligence and he also is reproductively fine. Caused by FGF, fibroblast growth factor. So that is actually causing the problem in growth. Gene leading to defective cartilage growth. Gene located again on short arm of chromosome number 4. You can see over here achondroplasia. Here is an image of a normal. There's a normal child, twin boys, and one twin over here suffering with achondroplasia. Now details of achondroplasia. Again, where you will learn about the details of achondroplasia, they will be dealt with when you study pathology and when you will study the orthopedics also. Again, this will come. So, normal intelligence and can produce money, and you might also see them in your television media also. Some actors who might be having achondroplasia, they do come, but you can correlate with it. Now, let's come to the autosomal recessive and let us see. So, common disorders like blonde hair, okay, albinism. You might be seeing schizophrenia. Schizophrenia, a lot of new movies have come of schizophrenia also. If you're interested, do watch them. If you have some spare time, do watch on movies both in our Indian film industry and in the Western film industry. A lot of very, very good movies have come from the diseases of brain diseases like schizophrenia. Then you have sickle cell anemia, such a big menace to the society. Sickle cell anemia. Visit any hospital and ask the residents over there to have a look at sickle cell anemia patients. You'll see them, and microphthalmia also. So these are some diseases of autosomal recessive. Now, like in autosomal dominant, we have seen over here. Let me go back quickly. These are the features of autosomal dominant. Similarly, we should know the features or characteristics of an autosomal recessive disorder. Person having single mutant gene does not express the disorder and is healthy. Autosomal recessive, no. So person like this is that will not be showing the clinical disorders. He will be healthy. Okay. Heterozygous individual is what? Carrier. As I said earlier also, this would be acting as a carrier. Carrier meaning by he or she would be fine phenotypically, but he might be transmitting the disease further on to the next generation. Trait is trait seen in same generation siblings, not seen in parents. So it can happen when it is not being seen in parents, but yeah, traits may be seen. Males and females equally affected, fine if parents are related. Again, first cousin's risk is many. So this is consanguineous marriages, as I've discussed them in a bit in detail also. These consanguineous marriages, because recently around a month back I was hearing some interviews or something related to genetic disorders only. We were having a small video conference, And in that case, the economy and those things came out of consanguineous marriages, so that we were discussing. Okay, autosomal recessive inheritance, and this double sign over here, this sign over here, it represents consanguineous marriages between first cousins of close relatives, and that might lead to the disorders, as you can see below, a male and a female over here. These two are affected. Okay. Now let's come to sex-linked inheritance, and after that, we'll go through the other two MCQs after a couple of slides. Sex-linked Y or X-linked. X-linked can again be recessive and dominant. Okay, let us see one over here. Let us just look at the Y-linked. Then we'll go into the MCQs. Y-linked, obviously, it is XY, male and female. Okay, then this Y will over here will go to offsprings will always be male only. Because if it is a female, it will be XX. Therefore, Y-linked disorders all will be related or shown to the male offspring only. All sons of affected males are affected, only males. So it is from father to son, father to son, father to son, father to son, father to son. This goes on and on like this. Only males are affected, females never transmit the trait like Hedipina. This is very important. Hyper is also known as hypertrichosis. Hypertrichosis. Here's in pinna over here, right? Over here, pinna. So if the father has had a hair over in pinna, then this thing will be transmitted to his son only. Simple as that. Okay. As said, we'll move to what? We'll move to the just second. Okay. The MCQs, right? Fair enough. Over here, just a second. Enlarge it a bit. Okay. So here we have come up with another MCQs. Okay, these two MCQs we have done. Let's proceed to another two MCQs. Single nucleotide polymorphism known as SNPs are most commonly associated with. Might not be very comfortable with this question, but yeah. SNPs, single nucleotide polymorphisms, are associated with what? You should remember it at least for the time being. Details will be discussed later on also. They are related to the personalized medicine. There's also medicine related to genetics, known as pharmacogenomics also. So single nucleotide polymorphism SNPs technology are used mainly by pharma industries related to genetics, pharmacogenomics. Remember this, right? Let's see one more question. I guess this should be easier one compared to the last one, that a karyotype is used to. Karyotype we discussed in the previous lecture. Assess DNA sequences, analyze chromosome structure, determine enzyme activity, or fourth option is measure protein levels. A karyotype is used to. Okay, very good. Manvi is giving answers. Manvi, you can also write in the directly in the chat box of our wherever this YouTube is going on. No, you can write over there also the answers A, B, C, D. Okay, so karyotype is used, and okay, karyotype is used to what? It is used to analyze the chromosome structure. Analyze the chromosome. You remember previous session we discussed about the entire Down syndrome, Edward-Patau syndrome, Klinefelter, Turner syndrome, all that. The karyotype was being shown to you. So wherever there's a trisomy 21, all that, and we use mainly for analyze what the chromosome structure. Okay, so these are two MCQs over here. As said, now let's come back to our topic which we are discussing over here. Okay, just a second. Okay, let me enlarge it a bit. Okay, let's move now from here. Okay, so Y-linked, I guess it is clear, hypertrichosis or heripena. X-linked recessive. So X-linked recessive, remember XX is female and XY is male. This we know. Understand X-linked recessive, if X-linked recessive disorders. Just apply your common sense also. See, most of the things are done by common sense. If in XY, if X-linked recessive comes, will it present clinically or not? Think, obviously it will. In XX in females, if there is an X-linked recessive heterozygous only a single dose, will it affect? I don't think it will affect. It is like autosomal recessive in female. X-linked recessive will act like as an autosomal recessive in female. Let us see. Some genes on X chromosomes are similar to genes present on autosomes. These genes have function other than determination of sex. like color perception or gene for blood clotting. Remember these. This will again come back in your biochemistry and your pathology. Some of the examples, not the all the cases of diabetes, but yeah, a few theories are linked to the diabetes mellitus. Hemophilia, so common. Okay, swollen knees, hemophilia, color blindness, DMD, Duchenne muscular dystrophy. Color blindness, you almost we have gone through those charts where the numbers are written. You must have seen the videos also, or if you have applied ever for any army sort of interviews and their basic medical test, then again this is checked, color blindness is checked. This, as a doctor, we should know, because we should know how to differentiate the colors while you are doing any surgeries or any other thing we are doing, right? So color blindness, hemophilia, remember these X-linked recessive characteristics. Now here comes the concept part. Recessive traits only manifest when genes are in double dose, as I said. XX, remember female, XY, remember male. And understand X-linked recessive. So recessive traits only manifest when genes are in double dose, right? Recessive traits are rare in females, obviously understood. Heterozygous female will not manifest the trait. So understand XA and X. It will not manifest the trait, but will transmit the gene to the next generation. Just similar to autosomal recessive when they were acting as carrier. Hence, heterozygous female is see carrier over here, correlate. Males have only one X chromosome, hence the mutant gene will manifest. So in males, it will act like a dominant disorder. Act like it is not dominant. Act like, because male only have one X, as they do not have a normal allele to compensate for a mutant gene. Male with a mutant gene on an X chromosome is called hemizygous, not heterozygous, but hemizygous. So if it was an autosomal recessive, we write it as like this, no, we call it as a heterozygous, autosomal recessive. But here, as the male will only have one X chromosome, so even that, if suppose this X is affected, you can't call it as homozygous, you can't call it as a heterozygous. So what is the middle path? Hemizygous. See the how do people play with words? This is how people play with words, and it makes a sense. Last point over here, that affected male will transmit to all his daughter carriers, obviously. From a male XY, this Y, whenever it will go to the next offspring, it will always be male. When this X of the male will go to the next offspring, it will always be female. And this X, if it is affected, then obviously this female will be affected like this, and it will act as carrier. Okay, we just follow the pedigree, the chart over here, the things become very sort of easy. So this is somewhat X-linked recessive inheritance chart being shown over here, and these are must to make in your exams. X-linked dominant now. Presence of a mutant gene on X chromosome. Okay, expresses in heterozygous females. Obviously now it is dominant. Affected male transmits to all his daughters, but not his sons. It is not Y-linked. Why would it be transmitted to son? So it is from father to daughter, father to daughter, father to daughter, never from father to son. Father to son was, just remember, father slapping the son for some mischief. The father slapping the son. So this is what is transmitted from father to son. Right? All others normally transmitted from father to daughters. Some disorders like vitamin D resistant rickets, hypophosphatemia, and other diseases like this last one over here, the XG blood groups and other stuff. Okay, X-linked dominant. Differentiation of autosomal dominant. How to differentiate the X-linked dominant from autosomal dominant? X-linked dominant disorder of an affected female is transmitted to all his daughters, but none of his sons. This we have already cleared. Okay. Now let's come to the polygenic and multifactorial inheritance. And after this particular subtopic, we'll again jump to our MCQ parts. Polygenic and multifactorial inheritance. Many common traits which do not follow simple Mendelian inheritance. Now, remember in beginning first or second slide, we discussed monogenic inheritance, Mendelian, or a polygenic inheritance. This is the second one, polygenic. Till now, we have discussed ARAD, autosomal recessive, autosomal dominant, X-linked, Y-linked, and next we have again seen what X-linked recessive, X-linked dominant. Now let's come to polygenic. See over here. In the previous session, we did an MCQ also, if I remember, which of the following was a polygenic inheritance, and answer for that was, I guess, eye color, right? Yes, here we see. Again, here it's eye color. So polygenic, some examples: intelligence of an individual having multifactorial reasons, height. Sometimes you will see that mother and father are, say father is 5'5", mother is say 5'4", and their children are 5'8", 5'10", 6 foot. So have some multifactorial inheritance. Weight of the child, normal weight, BP, hair color, skin color, hair color, eye color, the height of an individual, they have polygenic inheritance. A trait or disorder is determined by additive effect of many genes situated at different loci of chromosomes. Polygenic. Threshold traits disorders which are either present or absent. There are some known as threshold traits. Remember this line over here. Some polygenic inheritance are even congenital, like NTD. Now you might be wondering what is a neural tube defect. Again, go to embryology part, and then we'll discuss them more in detail when we'll come to the CNS part, the CNS embryology, neural tube defect. Let me give you an example of this. Just if possible, if you don't know them detail, just go and type spina bifida or search for it. You'll get all main causes and main examples of neural tube defects. Very common. Pyloric stenosis. You study them in detail in surgery. Cleft lip, cleft palate. We've discussed them in embryology, development of face, heart defects. Okay, heart defects and heart. Adult onset diseases, polygenic. These are congenital diseases. These are what? These are congenital polygenic diseases. Some are having their onset after some years, like diabetes mellitus. Now, if the mother is diabetic, father is not diabetic, children may be or may not be diabetic. This is may or may not be. Getting a point? If both mother and father are diabetic, chances of their children to be diabetic even later on increases, obviously. Now, at which age? It depends on multifactorial. The the diet of the children, how do they manage their weight, how much do they exercise, these are things, environment, air quality, and all that. So it there's a lot of things that will determine. There are cases when both the parents are diabetic. Even then, some of the children are not diabetic. That is also seen. Some disorders like epilepsy. Later on, it can epilepsy I have so many times. It can occur from any age. Hypertension, ischemic heart disease, schizophrenia, as I told, and obviously glaucoma also. Multifactorial inheritance. What is that? Some physical traits are not determined only by genes. Okay, but by interaction of genes and environmental factors. Now, this is something which is easier written than understood, because it is very subjective. If I say environmentally, this could be the reason. Now, it means a lot of things. But yeah, that is the reason. Because normally they don't follow any Mendelian law, but they still occur in few. They don't occur in few. So obviously, you have to determine that what could be the other factor. It comes out to be multifactorial, which mainly includes environmental factors, which includes a lot of things. You might see even some researchers having the twin babies, and one baby was born, one baby was raised up in another country, and the baby was raised up in another country or in another setup or in the setting. They both behave a bit differently later on, having twins. Okay, now a bit of the inborn errors of metabolism. Before that, let me again take you guys to your MCQs so that we see a couple of more MCQs over here. Okay, and okay, and okay. A karyotype is, we have already seen, and analyzes chromosome structure. Let us see a couple of more. Now, mitochondrial inheritance affects which type of genetic material? Mitochondrial inheritance. Nuclear DNA, chromosomal DNA, mitochondrial DNA, or cytoplasmic DNA. Cytoplasmic RNA. So, think about it. Mitochondrial inheritance affects which type of genetic material? Answer over will be, I don't think it's that difficult. Answer is straightforward. What? Mitochondrial DNA. Mitochondrial inheritance obviously will be affecting what? Mitochondrial DNA. And M for mitochondrial, M for mitochondrial, and M for mother or father? For mother. So M for mother or maternal. So that is also very important, mainly transmitted to the mother. One more question. Which of the following best describes the role of genetic markers? Options are, they identify specific proteins, genetic markers. They are used in linkage analysis. They determine the blood type, or they measure the glucose levels. The genetic markers mainly are used for, think. Take 10 more seconds. Time is running. Okay. So what will be the answer over here? Again, we are hitting some message chats. Option number B, well done. Yeah, they are using linkage analysis. Very well answered. Remember this, right? So genetic markers, mainly linkage analysis, they are used. Okay, let me move back to our discussion on inborn errors of metabolism. And in the previous lecture, I have told you that who was the father of inborn errors of metabolism? That was a scientist known as Archibald Garrett. Archibald Garrett, Garrod. Archibald. He used to come as an MCQ. That was why I still remember it. Okay. So these are the few things to determine in inborn errors of metabolism. It's a biochemical disorder, though genetically determined, but biochemical disorder. So you can see the inborn error from birth, or something related to metabolism. So biochemical disorder, genetically determined defect in some enzyme or a specific enzyme that would lead to a blockage, a problem in the metabolism that has a pathological consequence. So remember, the word itself has different meanings. When they're saying inborn error, that means something related to genetics, inborn, congenital. Inborn error of what? Metabolism. Combine them. Classification, like these are all the different disorders, like in amino acid disorders, we'll have PKU. What is PKU? Phenylketonuria. This disease known as phenylketonuria. You'll study in detail in your biochemistry, and then obviously later on in your second, third year, obviously you're going to study it. But in the first year in detail, you'll study that in your biochemistry. Albinism. Carbohydrate, you have glucose 6-PD deficiency, phosphodehydrogenase deficiency. In lipid disorders, we have Tay-Sachs disease, Niemann-Pick disease. In mineral disorder, we have Wilson disease. Mainly, Wilson is your defect in copper metabolism. Okay. Now, feline, the example is given to you like phenylalanine metabolism. This is a normal metabolism. Diet phenylalanine is taken up from here, converted to tyrosine, converted to dopa, then is converted to melanin over here. Okay. And therefore, enzyme can be these are the A and B are different enzymes being activated at these two specific your reactions. Enzyme A over here is phenylalanine hydroxylase and B is tyrosine. So defects can be over here. Phenylketonuria, as we discussed, PKU. It can be due to this, all these things, autosomal recessive, hydroxylase deficiency, and mental retardation. Albinism. White color skin over here. Skin color turns a bit pale or a bit white over here. That is usually autosomal recessive. We have discussed that in AR. Having see why you see tyrosinase over here, B enzyme, and what was giving rise to melanin. Obviously, if you have a enzyme defect over here, this melanin is not formed. Melanin gives the skin the color, some darkness in the color, just to provide the prevent the skin from having being protected actually against ultraviolet rays. That is the role of melanin. If there's no melanin, there will be albinism, as you can see over here, the tyrosinase deficiency, absence of pigmentation in the skin and the eyes, and that also we will study in detail about the melanin production in biochemistry. See, everything is linked. In biochemistry, you will talk about this whole reactions and all. Then as you come again to the anatomy, you have histology where you'll see all the layers of the skin, different layers. Where are the melanoblasts? How is the melanin produced? How it reaches the skin surface and all that. So can correlate. And here's an image showing you some of the African albinos. See, African are normally seen have a dark skinned people. But here you can see African albinos. Okay, hair color also disturbed. Now let's move to dermatoglyphics. What is dermatoglyphics? So I'll introduce you, then we'll again move to some more MCQs. Dermatoglyphics are the dermal ridges. Dermal means skin, epidermis and dermis. So they are the dermal ridges configurations on the digit. Digit means the digit, palm over here, and the sole of the foot. They begin to develop about the 13th week of prenatal life. The pattern of formation is complete by 19th week. Now, dermatoglyphics itself is very interesting. When before entering medical field, you all must be seeing that all those crime series, okay, fingerprints and all that, all those prints, how to determine them. Yeah, they are interesting. As you will write dermatoglyphics, you will start to search about it. There are a lot of papers, lot of researches done even in our India, in various areas even of India. A lot of researches have been done on this topic. I have also helped many of the residents over here in doing thesis on these topics. Okay, so dermatoglyphics, because see, it is not that difficult also. People can do it easily because you just have to take this sample is easily available in the college or in the society. And then you can study about it, you can print it, and you can understand what are the various. So In forensic also, it's going to be very good. So remember, that is what dermatoglyphs. Now, as promised, let's move to the MCQ, right? Okay, let us see the MCQs over here. Just a second. There you go. Okay, now some more MCQs. This, I guess, we already have done. Because the following best describes the role of genetic markers, and you already answered it as linkage analysis. Let us see one more. SNPs. What were SNPs? The nuclear polymorphism. Are most relevant. This, I guess, we already have seen. The question, personalized medicine, remember? Over where? Over here. Single nucleotide polymorphism were related for personalized medicine. I guess I already told you over there also. Medicine, pharma companies, pharmacogenomics, remember this. So that can be a beautiful question. Remember this. One more question. Mitochondrial inheritance is again. So if you are hearing, if you are attentive in the class, you easily answer it. I said mitochondrial DNA, M for mitochondria, M for maternal or mother. So answer is mother only over here. This is your answer over here. Okay, okay. Well done, Manvi. Very good. Well done. Okay. Right. Now two more MCQs done. Let us move back to our discussion. Okay, just a second. Right over here. So we were discussing, we begin with the dermatoglyphics. Okay, let us do at least dermatoglyphics. I'll show you some images. You might begin to have some interest in this. Dermal ridges are classified according to the distribution of triradii. What is triradii? They are classified according to triradii. Triradius or triradii is a point from which three ridge system courses in three different directions. Images will help you. And I always say image says 1,000 words. So triradius 3 are the three ridge system course in three different directions at an angle of nearly 120 degrees. So images obviously you can see over here. Okay, so coming from, you can see at this point, let me make a circle over here. At this point, this is like a triradius. So there's a ridge system in three different directions. One going over here, one going at an angle of around 120. Why? Because obviously we all know that the circle angle is 360. So three things are going. Obviously, they will be 120, 120, 120. 120 into 3 is this much math. I'm sure we all know. The 120 into 3 is 360 degrees. So approximately they go around 120 degrees. So that is the triradius. And this is how basically we have to classify about the dermatoglyphs. Now, what is classification? Let us see. Arches. This we're talking about the fingerprints. Arches, they have no triradius. Here you are not seeing any triradius. In these three images, there is no triradius. That is, if there's no triradius, we call it as arches type of the fingerprints. Then we have loops. Loops will have a one triradius. If you even you look at closely, or you take some ink and you just apply on your fingers and you take their print, their impression on the piece of paper, try to see. Loops, you can see they have one triradius. Now here I'm making circle over here. Here you're seeing the triradius, here again, and similar position over here also. So sort of similar images only. That is known as loops. Loops will have how many? Loops will have one triradius. One triradius. Okay. So that was arches initial. Now loops, then voles. Voles will have two triradii, W. So how to remember it? See, W over here, we write it now. W is like 2V, so it has two triradius. Something, try to remember it like this. So yeah, here you can see one over here and one over here. Okay, so you can see the two triradius over here. Similar images. They're known as voles. Finally, we have over here, these are the two. So remember arches, loops, and voles. At least remember that. Arches, they don't have any. Loops have one. And so ALW, remember 0, 1, 2. Number of triradius, ALW. Okay. ALW, make any mnemonic of it if you wish. Make your personalized mnemonics. ALW can have any mnemonic over here. But what is the utility of how to use it? To establish the identity of an individual, obviously. You go anywhere, even if you go for Aadhaar card, if you go to passport office, if you go to any basic identification, you go to any registration, anything, the fingerprints. Even if you are giving exams, nowadays fingerprints also to assessing chromosomal abnormalities. Therefore, related. Prenatal, what is prenatal diagnosis? And the important thing, what is prenatal diagnosis? Very important. There's something known as natal embryology we have discussed. In embryology, if you go to the first lecture topic or a topic known as gametogenesis. In gametogenesis, we discussed oogenesis. Oogenesis, that is formation of obviously oocytes, the female reproductive system. In oogenesis, we discussed that oogenesis starts before birth. So oogenesis has a prenatal period and it has a postnatal period, right? So prenatal is before birth. Therefore, prenatal over here determines that investigation before birth. So prenatal diagnosis is defined as detection of genetic abnormality before birth. Prenatal, natal, and postnatal. As there is very, listen to it very carefully. This is very important, and this will come in detail once you reach your gynae option. Now, prenatal diagnosis, as there is very limited scope of treatment of genetic diseases, because it's still, after all this development, all we have very limited resources to cure the disease of genetic. So as there is very limited scope of treatment of genetic diseases, it is important to diagnose a disease before birth so that the parents can take a decision about continuation or termination of life. This is a very, 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 very tough decision for the parents as well as a treating doctor. So now you have made the news out to the parents that your baby, your coming baby who's still inside the mother's has having this particular genetic disease, and we are 110% sure that this is the result of it. Now, what do you want to do? They will ask, okay, sir, okay, or madam, okay, that okay, what will happen? What is this? Is there any treatment? The first question will be, is there any treatment? Then you will say, okay, there is no substantial treatment. Researches are going on, and obviously all of that. And this will be, if there's also any treatment, then the maximum life of say any disease will be say 5 years or 10 years, 15 years, whatever it is, and it will cost you financially this much, mentally this much. I'm telling you a practical perspective what actually happens in hospitals. And then the doctor gives them options, or they will ask what options we have. These are the options. Either you want to continue, we will guide you later on also after birth. We'll assign you a team who might take care of it, and we have then the option of aborting the child. A tough decision for the entire team as well as obviously the parents. Right? So that actually it is very preventive, because if you don't tell them child is born, and they might never know that okay, they would have a chance to have it or not. That is a total different thing. You should know this. So prenatal diagnostic techniques are not used as routine basis, but as indicated for high risk. So where to use it? You can't be diagnosing every pregnant female for the prenatal diagnosis, right? It is reserved for high risk pregnancies where your chances are more. What are the indications? So have a look at this. Couples having family history of genetic disorder, point number 1. So this tells you the importance of history taking. Suppose a couple came, they are pregnant, the female is pregnant. Just normal conversation, you can ask them, is there any disorders which they can tell them about their siblings or their parents, like that, right? So changes of exposure to radiation or side. This is also important history. What are the drugs you have taken? Suppose a female came to know, okay, after 1 month or 2 months, obviously 2 months, that 1 month is minimum, that okay, she is pregnant. Then you might ask them, okay, have you taken any drugs in the previous 1 or 2 months? See, she could have some disease, she could have taken some cytotoxic drugs, we don't know. Have you gone for any X-rays or CT scan in this last 1 month or 2? Radiation history. Advanced maternal and paternal age, obviously, if their age is more than 40, 45 years of age, then fine. Family history of neural tube defects, as one word I told you, spina bifida, just have a look at it. Previous child with chromosomal abnormalities, then obviously the parents itself, they will tell you. Women suffering from diabetes or epilepsy, mother as a carrier of X. So all these things, these are the indications for having prenatal diagnosis. Spectrum of, these are the different procedures. You can just take a screenshot of it and go through it. Amniocentesis. Amnio is what? Amniotic fluid. Amniotic fluid, remember in embryology? So fluid is taken up from there. USG is ultrasonography. It is safe. Why? Because it does not impart any radiation to the mother or the child. So that is safe. Fetoscopy. So there is some, you are doing fetoscopy, scopy of the fetus. But you can see the risk of abortion. In amniocentesis, it was just 1 risk. Now you enter into fetus, to 5%. Now, fetal blood sampling, you're taking the blood out of the fetus, 10% risk for abortion. Maternal serum screen, obviously, you're taking the blood of mother, so it is obviously not that much riskier. It is simply safe. Chorionic, remember what is chorionic villus sampling? Remember in embryology, chorion and forming villi. Chorionic villus sampling, the placenta mainly, that is also having some risk for abortion over here. Ultrasound in pregnancy, let us see it. The different things given over here. So dating, Michael, just remember, don't have to cram them all, but yeah, at least remember that what are the different diseases that can be seen through ultrasound. Therefore, the role of radiologists in the society and a good qualified radiologist having good experience, and there's also nowadays, guys, a fellowship course. Residents who have done their PG even in gynae, MD or MS even in gynae, they go for the small fellowship course for ultrasound training of the pregnancy only, right? Because obviously they have done gynae, they know a lot. Even then, they need some extra, because nowadays it's excellency is what people aim for, and they should. You also all should. So things are going in this direction, not bad. Because if you are very good ultrasoundologist, you will be diagnosing some things which some people might miss, some radiologists might miss, and you might detect it. That's a good thing. Raised AFP from maternal blood, some of the alpha fetoprotein is what is seen, and if it is raised, it can be a indication of any of these disorders. Understand this. A raised alpha fetoprotein level in female or the mother over here, obviously, could be indication of all these disorders. Okay, now there's a fetal blood, from fetal blood having a good risk of abortion. You can detect these many diseases from thalassemia, sickle, again, very problematic thalassemia. Children come again and again for blood change and all. Sickle cell disease, hemophilia, immune deficiency, chromosome analysis. Treatment of many genetic diseases are not available, but can be managed to a certain extent, as I already told you. For this, you must be yourself be aware by the latest development which is happening not in your own country but obviously around the world. So if the parents or if their insurance of they are well off financially, they can take this path. They can go to some other place where the researchers have been fulfilled. If that is not coming to India currently, can give. So this depends on your present knowledge at that particular time. So be aware of it. Just go through whenever you guys have free time. Medicine is such a nice thing, no? Whenever you have free time, just type about these latest inventions, latest researches, latest discoveries in medical treatment, genetic disease treatments, latest, and you'll get a lot of knowledge of what is happening around. Because in books also, books are printed, for example, 2023 or 2024 January, and they'll publish, they'll come to use. Obviously, 6 to 8 months have already elapsed. 1 year has already gone by, and that is not obviously latest. Let us see. So, genetic patient over here, a patient having the problem, so obviously seen by a genetic counselor, that is best. And the genetic counselor will do pedigree charting, carrier detection, and obviously relevant family members. There will also be a clinical examination. And obviously, looking at the cytogenetics and monitoring of the pregnancy system. Okay, so you have this genetic counselor is a must, or genetic counselor is a must in good big hospital. Basically, who have this giving us to the pregnant, the maternity wards and all. A good genetic counselor is needed over there. Oh, there's one more thing known as recombinant DNA technology, genetic engineering. Okay, we'll just go through it briefly, but again, 2 MCQs were left with. So let us first of all do those 2 MCQs, then we'll come back over here, right? Okay, so let us come to our MCQs over here. So mitochondrial, we discussed this. M for mitochondrial, M for mother. Okay. Genetic recombination. Okay, genetic recombination leads to. Options are uniform genetic outcomes, genetic diversity, reduced chromosome numbers, or identical twins. So recombination of genetic material will lead to what? Again, can use a common sense over here. Very good. Option B, very well done. Answer is option number B, genetic diversity. That will lead to genetic diversity, genetic recombination. Last MCQ, all the best. I guess this we have done. Karyotyping is particularly useful for diagnosing some sort related. Karyotyping. Structure of chromosome is what is seen over there, right? Structure of chromosome is what is seen over here. Someone is asking about some explanation in Hindi. Okay, Aman. Okay, हम देखेंगे इसके बारे में हाउ वी कैन डू, क्योंकि दोनों लैंग्वेज एक साथ होना थोड़ा मुश्किल है, वो टाइम कंस्ट्रेंट है. मैक्सिमम रीच देखी जाती है, मैक्सिमम बेनिफिट कहाँ हो रहा है, बट आई विल ट्राई माई बेस्ट टू, मैं ट्राई करूंगा कि आगे कुछ इंपॉर्टेंट पॉइंट आएगा उसको हिंदी में भी डिस्कस करेंगे, ठीक है, बिकॉज यहाँ पर इंग्लिश में मटेरियल लिखा है तो ज्यादातर इंग्लिश में बात होती है, बट या इन हिंदी भी कोशिश करूंगा कि हिंदी में भी कुछ कुछ चीजें कवर, ठीक है। ओके, सो कैरोटाइपिंग इज फॉर व्हाट? कैरोटाइपिंग किसके लिए है? अगेन आंसर वेरी गुड, सो दैट इज सिंपल फॉर्म, बट क्रोमोसोमल डिसऑर्डर्स, क्रोमोसोमल डिसऑर्डर। Okay, so all the best for the MCQs and thank you for the MCQs. Let us do this last point. ये last point करते हैं. That is our recombinant DNA technology. Okay. और genetic engineering. कुछ basics ले लें इसका. Okay, we'll take some basics of it. DNA molecule. See, what is recombinant DNA technology? Recombinant DNA technology होता क्या है? DNA molecule is broken at two desired sites. DNA molecule is broken, तोड़ दिया जाता है at two desired sites. स्पेसिफिक डीएनए सेगमेंट ऑब्टेन। अब आपने एक, जस्ट इमेजिन दिस रोप, एक धागा है, इमेजिन करो उसको दो जगह से काट दो, कट इट फ्रॉम टू पार्ट्स, यू गेट अ स्पेसिफिक डीएनए सेगमेंट। थर्ड पॉइंट, दिस सेगमेंट इज देन इंसर्टेड इनटू अनदर डीएनए मॉलिक्यूल एट अ डिसाइड पोजीशन। उस टुकड़े को लेकर कहीं और जोड़ दिया, यू टुक दिस दैट सेगमेंट एंड एडेड टू सम अदर सेगमेंट, द डीएनए दस ऑब्टेन, सो रिकॉम्बिनेंट हो गया ना। यू टुक अ DNA molecule, you broke it at two sides to take a specific DNA segment and insert into a DNA molecule. आपने एक रस्सी सा इमेजिन करो, इमेजिन एक रस्सी है, दो जगह से काटा, एक सेगमेंट उठाया और कहीं पे जाके जोड़ दिया उसको, तो क्या बना? घूम फिर के रिकॉम्बिनेंट डीएनए। दिस आर जस्ट इमेजेस टू हेल्प यू अंडरस्टैंड रिकॉम्बिनेंट डीएनए। कुछ इमेजेस देखो। ओके, here you can see that how they are separated over here, blunt ends of DNA. हाँ, this is something that you can understand, or this image will let you understand. ये image आपको समझाएगी। So focus over here, donor DNA, यहाँ देखिए ऊपर क्या लिखा है, donor DNA, and there is a vector. Vector क्या होता है? Vector is someone who carries. Vector वो होता है जो उसे कैरी करता है। तो donor DNA, you can see, donor DNA को यहाँ से तोड़ा गया है, okay, and then a specific segment is taken, है ना। vector same happens to the vector also. Vector is also broken up and a specific segment is taken. So vector and donor DNA are digested by restriction enzyme. So which enzyme is playing a role? That can also be asked. It is a restriction enzyme. ठीक है? Then they did what? एक donor DNA का टुकड़ा लिया and they took a piece of donor DNA and they took a piece of vector DNA. दोनों का they took a pieces and with the help of DNA ligase. So here ligase enzyme helped. लाइगेस ने क्या जोड़ दिया, इट एडेड एंड इट सील्ड, ठीक है। नाउ दे टुक, दिस इज द रिकॉम्बिनेंट डीएनए मॉलिक्यूल, ये जो यहाँ पे दैट इज रिकॉम्बिनेंट डीएनए मॉलिक्यूल, ये याद रखना, दैट इज रिकॉम्बिनेंट डीएनए मॉलिक्यूल। नाउ व्हाट यू हैव टू डू इज, नाउ दिस इज इंट्रोड्यूस इनटू द बैक्टीरियल सेल। हियर यू कैन सी, यहाँ आप देख सकते हो, दीज आर द रिकॉम्बिनेंट डीएनए मॉलिक्यूल्स। कहाँ इंसर्ट कर दिया इसको? इनटू द बैक्टीरिया। नाउ रिकॉम्बिनेंट डीएनए मॉलिक्यूल्स दे रेप्लिकेट, तो यहाँ क्या होगा, दिस डीएनए विल रेप्लिकेट एंड द होल बैक्टीरिया विल रेप्लिकेट। दिस इज नोन एज क्लोनिंग। इसको क्या किया हमने वी हैव, हमारी इच्छा से, बाय आवर ओन विश, व्हाटएवर टाइप ऑफ रिकॉम्बिनेंट डीएनए मॉलिक्यूल वी वांट, व्हाटएवर टाइप ऑफ वांट वी वांट, उनके हमने क्लोन बना दिए, वी मेड द क्लोन्स ऑफ इट। दैट इज एन एग्जांपल ऑफ रिकॉम्बिनेंट डीएनए टेक्निक। ओके, गॉट द पॉइंट? दैट इज एन एग्जांपल ऑफ इट। चलिए आगे बढ़ते हैं और let us see more use of genetic engineering. Just take a screenshot, इसका screenshot ले लो so that you have something to write. This recombinant DNA technology over here, if I go again, this is the genetic engineering. यही genetic engineering है, recombinant DNA technology. Use क्या क्या है? To find the structure of gene, diagnose disease, carrier detection, gene therapy, and synthesis of hormones. Application, again you can take a screenshot of it and understand. DNA cloning, PCR is again polymerase chain reaction, so that is a different thing. Okay, that is a different thing altogether. Okay, so guys, this ends our discussion. ये यहाँ पे discussion खत्म होता है. This ends our discussion of genetics. So genetics part, all the both parts are done. All and do revise it. If problem आए तो can ask in the comment box. Any issue? And I guess from now on and after a couple of days, we will start with the upper limb. Upper limb से शुरू करेंगे. That is our the shoulder region, hand region पूरा ये, ठीक है? Okay, so that's all from my side. Thank you. Bye bye. Good night. Take care and all the best.